Hey guys, I was actually planning on talking about this in the next couple of weeks, but given that the one big beautiful bill has now been signed into law, and as a nurse, it will directly impact my work and healthcare more generally. So I figured I should talk about it sooner rather than later, right? So why is this bill so important? It would cut nearly $1 trillion, which is just an insane amount of money, no matter how you think about it, from Medicaid and funnel that into tax cuts for wealthy Americans. Kind of like reverse Robin Hood, which makes a lot of sense as long as you don't think about it too closely. But the sneaky part of the bill is that these Medicaid cuts won't actually take effect until after the 2026 midterm elections. So the GOP is just kind of hoping that their voters will forget about this in the next year and a half. So their voters won't actually feel this pain until after they, hopefully for the GOP, vote Republican. Let's take a look under the hood here and see what the Republicans in Congress are planning for Americans here. It bundles tax cuts, budget caps, and healthcare reforms bundled with massive explosions in spending on ICE and military, which a lot of this sounds good in sound bites, but it hides major Medicaid and Affordable Care Act cuts. It's kind of like the Trojan horse of bills, especially when you look at its outsized impact on rural areas, which I used to do my clinicals in a critical access hospital, which is one of these most vulnerable areas to getting shut down. And thinking of how they're going to be keeping their doors open does not exactly inspire me with confidence, considering how reliant on Medicaid funding they are. This means that the patients in the area might have to travel 45 minutes or an hour to get to another clinic or hospital where they could get care. And any of the other nurses out there can confirm that when you have a major health event like a heart attack or a stroke, minutes matter in these events. So if you have to wait an extended amount of time for EMS to arrive, or you have to find a ride to the hospital yourself, your risk of poor health outcomes goes up exponentially. So, like I said, almost $1 trillion are getting cut, which is just crazy still. Um, and millions of people are going to lose their health insurance from this. And it's still going to add well over $3 trillion to the national debt. Crazy amounts of money here. Some of these cuts will include limits on provider taxes, which provide a disproportionate amount of funding to rural healthcare, cuts to Medicaid expansion, which will especially hurt working class families who are just above the poverty line in both red and blue states, as 40 states are currently in this expansion program. You're going to have more work requirements, despite a lack of evidence that shows that they actually are helpful. For example, in Arkansas, I think it might have been around 2018, they added a work requirement for Medicaid, and tens of thousands of their residents quickly lost health insurance. And there was no statistical increase in employment among these folks. So it didn't wind up doing what they wanted it to. And a lot of these people lost coverage because they were unaware of the rules had changed, or they had variable work hours in a part time job, which makes it difficult to report how many hours a week you're working to Medicaid when they verify stuff like that. So there tends to be this image of a healthy 30-year-old man playing video games in mom's basement on Medicaid. That's just not really accurate to the type of people that Medicaid serves. It's not a slush fund for lazy people. The vast majority of Medicaid money is for the elderly and disabled, along with children. For example, around 63% of nursing home residents and almost 50% of children in the US are currently on Medicaid. You're looking at over 300 rural hospitals that will face closure from this. A lot of them in states like Kentucky, Louisiana, Texas, Mississippi, and millions of Medicaid enrollees could lose their coverage. I've seen anywhere from 10 to 18 million people could lose their health insurance from this. And the brutal reality is that 1 in 4 nursing homes have said that they are going to close, and additional homes will have to reduce staffing further than they already do. And where do you think grandma's going to go? That's right. She's probably going in your spare room or a different facility that's hundreds of miles away from you because there aren't any available long term care or rehab beds available in your area. Make no mistake, I already see this in my day to day working life. So I can only imagine how rough things could get if these cuts really come to fruition. Some ripple effects from the bill include things like longer emergency room wait times, because when large amounts of people either aren't able to physically make it to a hospital or clinic for preventable care, that means that they just wait and wait, and these problems get worse and worse. And then they're forced to go to the ER when they can't handle it at home anymore, which is way more expensive than prevention, always. And that means that if these hospitals close, your patients are going to have to travel hundreds of miles, pay more money, and have harder times accessing their health care. Hospital closures, especially in these rural areas, for many rural communities, the hospital is the biggest or the second biggest employer for them. So when they have to cut staff, normally what they'll do is they'll close down certain units, say their labor and delivery unit, or they'll shut down half of their operating rooms to reduce expenses. That doesn't mean that the people in town suddenly don't have to give birth or need surgery anymore. Now they just have to travel hours and hundreds of miles to get that care. One of these effects that I saw firsthand in a critical access hospital was the need for very expensive services like air ambulances, because there was no other way for EMS to realistically get out to those patients in a good amount of time for better health outcomes. And the average cost for these air ambulances is tens of thousands of dollars, which is way more than your typical ambulance ride would cost here on the ground. So not only does this increase costs for patients, but it also means delayed care. And if there's severe weather, which a lot of remote areas get, that'll often prohibit flying. So they might not even be able to get to you until several hours later. And the worst thing about this for me is just the straight up lying that's being done, because they're not telling you the cost of these things in human lives. People will die because of this. People will go bankrupt because of lost health insurance, and the medical bills will keep piling on. And a lot of these politicians claim that no one's going to lose care, but these projections by multiple sources are still demonstrating that tens of millions of people will lose their health care. Public statements by leaders like John Thune or Mike Johnson are vague by design, because they're hiding the real consequences of the bill in the fine print. And this stuff matters even if you aren't on Medicaid, because your ER depends on these reimbursements. And if more people are delaying care, more are winding up in the ERs with preventable problems that a clinic could have dealt with months prior. And that's going to slow down care and increase costs no matter what insurance you are on. And if a hospital closes, you will wait longer, you'll travel farther, and you will pay more. So this isn't just about health insurance, it's about access to healthcare and economic stability for these areas. So we really need to stop treating healthcare like some kind of luxury and start defending it like the human right that it is. So contact your representatives or senator, let them know that this will cost real people their lives and financial stability. But if you're a nurse, a patient, or someone who just wants to understand how systems affect care at home and around the globe, hit subscribe, drop a comment below, tell me what you've seen or what you would like to see covered. Thanks for being here.